Millions of people sleep every night but never truly rest. Their breathing stops again and again without them knowing it. This is sleep apnea, a condition far more common and far more dangerous than we realize. What happens when sleep itself becomes unhealthy? Sleep apnea affects children, adults, men, women, across body types and ages. Yet, most people remain undiagnosed. Today on NDTV Lifeline, we decode sleep apnea, why it happens, how it harms the body, and how timely treatment, including breathing support machines like CPAP and BiPAP, can be life-changing. But before we go deeper into sleep apnea, take a look at these numbers because this data is genuinely alarming. Around 1 in 10 Indian adults has obstructive sleep apnea. 11% Indian adults have sleep apnea. 10.4 crore affected nationwide. Men are more affected, but women are underdiagnosed. Nearly 50% are moderate to severe cases. Major link to heart disease and diabetes. Most Indians with sleep apnea don't know that they have it. Untreated sleep apnea costs India over rupees 23 lakh crore yearly. Extrapolating to over 100 million cases, the lifetime productivity loss per person alone tallies 1 to 2 lakh crore yearly. What is sleep apnea? Sleep apnea is a condition where breathing repeatedly stops and starts during sleep. Each pause drops oxygen levels and jolts the body into stress mode, sometimes dozens of times every hour. The types of sleep apnea: obstructive sleep apnea, where the airway collapses during sleep. The next one is central sleep apnea, where the brain doesn't signal breathing properly. And the last one is complex sleep apnea, which is a combination of both. On NDTV Lifeline today, our doc on call is Dr. Atul Mittal. Thank you so much, Dr. Mittal, for joining us today.
Thank you, Ambika.
I think to begin with, first we need to understand what really is sleep apnea.
Sleep apnea is obstruction in airway while you sleep. So whenever there is an obstruction in airway, there is a decline or decrease in oxygen levels in the body. That leads to decrease in the perfusion of blood supply, perfusion of oxygen in the end organs, and that can be a brain, that can be a heart. And sleep apnea leads to is a slow killer or a slow poison which affects every end organ in a later stage.
So that is why they say sleep apnea can kill you. We hear so many more cases that, I have sleep apnea. There is more awareness today on sleep apnea, but still there is a gap. A lot of people are not really aware of what it is. That's why I asked you. But what really are the symptoms, Dr. Mittal?
See, there are two reasons why if you say poison, it's not a poison, it's a slow killer. If you see, a lot of studies have been done. 2 to 4 midnight, you find maximum strokes happening. 2 to 4 midnight, most of the cardiac arrest happens or a heart attack happens. Why? And all the precursor of these problems are obstructive sleep apnea. So whenever there is a lack of oxygen in the body, the heart is in stress, the brain is in stress. That's why ultimately you land up in this complication.
So definitely it's something one has to take care of because it's affecting and impacting the other organs, like you rightly said.
See, it's a pandemic right now.
Yeah.
And it is prevalent in every age group. From children to old age, you will find sleep apnea. Sleep apnea is basically a lifestyle problem also. You find a lot of young kids having an obesity. So because of the obesity and sleep apnea goes hand in hand. More is a child obese, lesser the lung capacity, more will be the requirement of oxygen, and more will be the sleep apnea.
So it's all interconnected. And when it comes to the ENT factors, like whether it's a blocked nose, enlarged tonsillitis, we also hear about the jaw shape or the tongue. How do these factors, from an ENT's perspective, really contribute to sleep apnea?
See, you need to understand what is this upper airway contributes. So our upper airway includes nose,
Which is here,
the
yeah.
paranasal sinuses, the nasopharyngeal area where you will see a lot of children having adenoids, the oropharynx where you see the tonsils, base tongue, and this is the most soft tissue area. This is the collapsible area. So whenever there is a obstruction in this airway and the body muscle relaxes, this collapses and this leads to the sleep apnea.
Okay, so you've explained us what leads, and right, we know we have to take care of it. It is a serious problem. It affects all our parts. Now coming to snoring, when do we know snoring is sleep apnea or not? कई बार हम कहते हैं we're very tired, that's why we're snoring. What really is the red flag to understand that this, or it's an important symptom for sleep apnea? Because all snoring is not sleep apnea, is it?
See, snoring, we all deal it as a social problem. All snorers are not usually a sleep apneic.
Okay.
But all sleep apneic are usually snorers. So snoring is a sign that you can lead to a sleep apnea. Secondly, other signs. If you are snorer, you see a patient or a person having a tiredness. I'm not able to sleep. My sleep is not complete. I don't wake up fresh. Tossing and turning at night. Not going into a calm sleep. Awakening spells or arousal spells. Daytime tiredness and sleepiness. They are the signs which you should look for.
So besides snoring, these are the symptoms one should be looking, or especially not waking up fresh, so you know, well, that is a sign. Dr. Mittal, you said, any age group can have it. As a parent, obviously, I worry, for children, right? So what is something that I should look out to see that if my child has sleep apnea or not?
First, very important is your child sleeping like a baby? Observe him in sleep. If he's tossing and turning, he's snoring, he's turning obese, depending upon the age of presentation, he's losing the interest in sports activity. That's an important sign.
So those are the symptoms to look out for. Okay, and also surgery, right? We hear a lot about, of course, one is treatment and surgery. What are the cases which benefit from surgery?
See, it's very important to first you do a sleep study. Sleep study tells us it quantifies the amount of sleep apnea.
Okay.
But it doesn't tell you where is the obstruction. So there are modalities nowadays that are called drug-induced sleep endoscopy. We make a patient sleep with the help of drugs in a natural sleep. And side by side we pass an endoscope and see during the sleep where localize the obstructive site. And depending upon whether it's a nasopharyngeal area or adenoidal tissues are obstructing, we remove the adenoids. If the tonsils are obstructing, sometimes the palate there's anterior posterior collapse because of the palate, we trim the palate. If the base tongue is enlarged, there's surgeries and laser surgeries where we do the reduction of the base. You have seen a lot of patients having a microgynecia or the chin is back. There the tongue is attached to the back side of the mandible. So in these microgynetic patients, so you see the fall of the tongue back and leads to the collapse. Here some advancement surgeries are done. You do mandibular advancements, maxillary advancement surgeries are also done for sleep apnea.
And of course CPAP and BiPAP, like you said, it's a multidisciplinary, we are going to be getting a pulmonologist as board as well today on Doc on Call. So the machines of course take care of, if one can avoid the surgery, then the machines come in here.
It's very important. See at what age group you come. If surgery is always a last resort.
Yes.
But if the surgery is an answer, it should be done. So what we should have in holistic approach should be there for the treatment of sleep apnea.
Okay. So which of course, like you said, weight loss, first getting to know the symptoms, weight loss, and of course reaching out to your doctors as well. Dr. Mittal, there's this recent study in Lancet, which talks about this oral medicine called Sultami, and that actually that reduced breathing pauses in people with obstructive sleep apnea, and they're saying this could be an alternative to CPAP. Now, from an expert like you, how significant do you think this development is from the ENT perspective? Your thoughts on that?
See, it looks very adventurous. It's not, Sultami is still not being FDA approved. It is still in the research, and it's basically a carbonic anhydrase inhibitor, and basically it tones up the muscle. It's actually a drug for epilepsy, which being tried, which being studied, and it's not very good effective for the severe form of sleep apnea, but a moderate sleep apnea can be treated. It's still in a preliminary stage. We have to see the results.
Okay, and lastly, a takeaway for our viewers today watching us on NDTV Lifeline for sleep apnea from your perspective.
Sleep apnea is one thing is multidisciplinary approach. Look for the signs and symptoms, and never think that surgery is the only answer or CPAPs are the only answer. We should treat it holistically.
Well, thank you so much, Dr. Mittal. It's been a pleasure to have you with us.
Thank you.
On NDTV Lifeline, our second doc on call is Dr. Guleria. While Dr. Guleria, we spoke to Dr. Mittal about, from the airways, from the ENT perspective. I want your expertise when it comes to a pulmonologist from the lungs perspective. So if you can tell us what is sleep apnea and what really happens to the oxygen and carbon dioxide levels at night when someone is sleeping who has sleep apnea.
So in a person who has sleep apnea when he's sleeping, when you sleep, your muscles relax, which is part of sleeping, your respiratory rate comes down, and the muscles of the pharynx, the upper airways, as they relax, the airways start becoming narrow and narrow, and a point comes when the airways collapse and you have obstruction at the upper airways, but you're trying to breathe. Your lung is trying to breathe, you're trying to get in oxygen, you're trying to remove carbon dioxide. That is not happening. So the oxygen in the blood becomes less, the carbon dioxide goes up, and this causes multiple changes in the body. It also stimulates what we call the sympathetic system, and it also leads to increased pressure as far as the chest is concerned, the thoracic cage is concerned, which also causes strain on the heart. So it leads to low oxygen, high carbon dioxide, increase in sympathetic activity and strain on the heart, which leads to what we call alteration as far as the blood supply is concerned.
So you said drop in oxygen. So repeated drops in oxygen during sleep, what is the impact directly seen, whether it's the heart, whether it's on the brain, metabolism? Could you briefly tell us about how serious sleep apnea can be if it's not treated?
So sleep apnea can be very serious because 2 or 3 things happen. One is when your oxygen drops, oxygen to the heart also becomes less, so it increases the chance of heart attack. It also increases the chance of heart rate becoming irregular, what we call arrhythmias. So you can have arrhythmias at night because of serious sleep apnea. Also, because of this cyclic changes in your oxygen and carbon dioxide, which affects the body, it can lead to what is known as metabolic dysregulation. So your metabolic dysregulation means that it's leading to changes in your metabolic system, which means it leads to fatty liver, it can lead to insulin resistance, and also leads to higher chance of developing a rise in your blood pressure, high sugars and fatty liver. And all of this of course is linked to the fact that sleep apnea has a link with obesity itself also.
Yeah, so huge impact on overall health if it's not treated well, right? Talking about the symptoms or the daytime impact, whether it's memory loss, whether it's fatigue, also could lead to an accident. Again, how serious are these issues? Because a person is not, I think, waking up fresh when it comes to sleep.
Correct. So when I said you have oxygen dropping and carbon dioxide coming, you go from deep sleep to light sleep. The person doesn't realize it, but he gets what we call fragmented sleep, and therefore during the day there is daytime sleepiness. He doesn't feel fresh. And I've had one patient who was actually going on his scooter to drop his daughter to school, and he went out to sleep, and they had an accident and his daughter got quite a lot of injuries. So you can have, so if you have sleep apnea, you should not drive if you're not taking proper treatment, because you can go off to sleep and there can be major accidents. And there is data from even the West which has linked major highway accidents to sleep apnea. Similarly, it can lead to less alertness. You're not that alert during the day, and of course it can lead to a number of other problems like daytime somnolence. You tend to go off to sleep while watching television or even reading a book for that matter.
So also, what are the, like you said, that these are the symptoms, right? And you need to look out for the diagnosis. Is the sleep test the gold standard?
So the gold standard is to do a polysomnography or a sleep study. The sleep study can be done in the hospital, but now we have better technology, so smaller machines are available, so it can be done at home also. So home-based sleep study or a hospital-based sleep study is the gold standard.
Okay. Lastly, you've told us everything about sleep apnea, but once you diagnose it, once a person feels, yes, I need to be treated, what is the treatment?
So treatment of choice as of now is using a CPAP machine. It is a machine which actually just pushes air into your airways and keeps the airways open, don't allow them to collapse. And because of that, your carbon dioxide doesn't go up, your oxygen doesn't fall, and the strain on the body becomes less. There are other treatment strategies also, like lifestyle modification, weight loss, sleeping on your side, which also help. And there are new techniques which are also coming up, like hypoglossal nerve stimulation.
And lastly, if you can tell us about the different masks with the machine and if these machines have any limitations.
So the machines are something which are really very useful. They really don't have a limitation per se, but you need to see what machine suits you. The most important thing is the mask, which you call the interface between the machine and the person. You have to choose a mask which is suitable for you, with which you are comfortable. We have full face masks, we have a nasal mask, we have nasal pillows, and these masks have now become so simple that they are not that claustrophobic, and depending on how comfortable you are, you should select a mask which is suitable for you.
Well, thank you so much, Dr. Galera, for joining us and speaking on something which really needs to be spoken about, and maybe it's something so simple, like you rightly said, once it's dealt with, it can become a way of dealing and living better. Thank you so much.
Thank you very much. Thank you.
So as we grow older, we tend to snore a little bit, but loud snoring that causes is not normal. It could be a feature of obstructive sleep apnea. That's not true. Although sleep apnea is more common in people who are obese, lean people also get sleep apnea. That's not true. We've done studies which show that even children who are obese can have sleep apnea. CPAP machines and masks are a treatment of obstructive sleep apnea. It's not a serious business. It's something which can change your life if you use it regularly. That's not true. Sleep apnea is not only about snoring and disturbed sleep. It can lead to a number of problems which are cardiac, neurological, and related to metabolic syndrome.
Hello everyone, I am Dr. Gopal Chawla, pulmonologist and sleep medicine physician, and today I am sharing some simple but effective hacks for sleep apnea. First is the sleep posture. So sleep on your side. When you sleep on the back, your tongue falls back and can obstruct your breathing. You can place a pillow behind your back or even sew a tennis ball onto your t-shirt while sleeping to prevent from rolling onto your back during the sleep. This is called as positional therapy. Now let's talk about pillows. Avoid very high pillows or very flat pillows. There are some cervical support or contour pillows which helps in maintaining a proper neck alignment and may improve airflow during the sleep. Now let's move on to my favorites, which is myofunctional therapy, and these exercises really make a difference. These exercises strengthen the tongue, throat, jaw and soft palate muscles and helps you sleep better. First is a tongue slide exercise. Place your tongue behind the upper front teeth and slowly slide it backwards along the roof of the mouth for about 3 minutes daily, like this. Next is soft palate blowing. Puff your cheeks with your mouth closed and hold for 10 seconds and repeat 10 times, like this. Next is very funny, throat tiger yell. Open your mouth wide like a tiger roar without making sound and stick the tongue out fully and hold for 5 seconds, like. Next is a singing exercise. Sing A, E, I, O, U loudly while keeping your tongue out towards the either side, like Next is a fish face. Suck in your cheeks, make a pout like a fish and slowly move your face towards right and left, like this. Other one is jaw exercise. Move your jaw forward and hold briefly and repeat it like this. So you can also do these exercises any time of the day, morning or evening. These exercises helps improving a muscle tone and reduce airway collapse during the sleep. Practice these exercises regularly. Thank you.
When it comes to sleep apnea, better sleep means better breathing. Sleep position matters because side sleeping helps reduce collapse. Weight and neck health. Small weight loss can improve symptoms. Alcohol and late meals worsen apnea. Avoid before bedtime. Nasal care. Treat congestion and allergies seriously. If you're sleepy by day, please don't ignore it. Sleep apnea is often missed, but our prescription on NDTV Lifeline is simple. Follow the checklist, get evaluated, and don't delay a sleep test. The checklist is loud chronic snoring, breathing pauses witnessed, morning headaches, daytime sleepiness, poor concentration, high blood pressure or diabetes with fatigue. If yes, get evaluated. Tests often include sleep study, which is the polysomnography, ENT and lung assessment. Sleep apnea is treatable. Ignoring it is dangerous. Better sleep isn't a luxury, it's therapy. And breathing well at night protects how we live by the day. So take care of yourself. Take care of your sleep. Look at the symptoms. Sleep is a very critical part of our lives. Well, that's it on NDTV Lifeline. But for all our viewers, remember, our lifeline is the only lifeline we have.